All right. So today I'm going to be talking about the different toxicology groups as well as kind of what your patient's going to look like whenever you see patients like this, as well as how we would treat these and how hospitals would treat them. So I'll start from the top and work my way down. So we'll start with anticholinergic. So your anticholinergic patients are going to be pissed and dry. They're going to be really agitated, and the first sign you're going to notice with these patients is dry mucosal membranes. So in like the mouth and stuff like that, like the eyes, they're going to be dry. You know, on the truck, we would treat this with benzodiazepines if they were experiencing seizures, and the hospital would give this drug here. I'm not even gonna try and pronounce it because I'll butcher it, but that's what they would get at the hospitals to revert that. Now, cholinergic think the opposite. They're gonna be tired, depressed LOC, and they're gonna be wet. Think of our sludgum, so our salivation, lacrimation, urination, defecation, GI upset, emesis, and muscle twitching. They're gonna be wet, be gross. First sign, and this is a drug we do have, is we're gonna treat it with atropine. So what we would use to reverse that. Now opioids, they're gonna be breathing slow, depressed LOC. Look for your pinpoint pupils, and this is another one we have on our trucks, Narcan. You direct what's the word? Direct counter to opioid overdose is Narcan, as well as providing airway support if we, for some reason, didn't have Narcan. Provide airway support. Even if we did, don't just leave your patient, right? Don't just give them Narcan, call it a day. But, airway management and Narcan. Sympathomimetic, they're gonna be hyped and they're gonna be scared. So think of what adrenaline does. Adrenaline is a sympathomimetic hormone, and it gets you scared, causes your constriction or your dilating of the bronchioles and your tachycardias. They're going to be experiencing the same kind of symptoms, tachycardic, things like that. So look for cooling measures for these patients because they're going to be sweating, their body's going to be overreacting, and treat seizures with benzodiazepines. Now, malignant hyperthermia, think, they're hot, right? So what do you do when someone's overheating, when they're hyperthermic? You cool them down. And if it's to a point, you correct acidosis, be that by breathing for them or with sodium bicarb. Neuroleptic malignant, they're going to be stiff and confused. So they're going to be kind of shaky, but more like rigid. They're tense. Their muscles are going to tense up, and they're going to be confused, right? With these patients, you're going to want your non-depolarizing drugs, like your non-depolarizing neuromuscular drugs. So that would be your ROC and your VEC in particular. Next, we're going to do serotonin, which they're going to look annoyed and they're going to be sweaty. They're going to be diaphoretic. And this, we treat the fluid loss with fluids. And if they experience seizures, benzodiazepines. Now, acetaminophen is one with a specific cure, and most trucks don't carry Mucomyst, but your patients who have acetaminophen overdoses within the first 3 hours, they're going to be kind of anorexic and they're going to be puking a lot. So that's, and for mucomyst to work, the cure for it here is you have to get it within the first 3 hours of exposure to the acetaminophen. Without that, you have complete hepatic failure and a slow and painful death. So these are very important to figure out very early and look for the key signs that they're more kind of anorexic, pale, and they're puking a lot. Now our amphetamines, think of like methamphetamine, stuff like that, right? They're going to be shaking and they're going to be restless. Now, for these patients in particular, you can try to use activated charcoal. Those tend to stop working after they have absorbed the drug, or if they've used the IV route, right? It's not going to work too well. So mainly with these patients, you're focused on their ABCs, right? Benzos, if that shaking turns into seizures, but focus on your airway, your breathing, your circulation, driving to the most appropriate facility. Next is your benzodiazepines, so the things we use to treat seizures, right? Causes eventual sedation if given in too high of doses. Same thing happens here. They're cold and they're slurred. They become hypothermic, and their speech is slurred. They get confused, decreased LOC. With this, you can try activated charcoal, and this doesn't work too well if it's taken by IV route or if they've already absorbed it. And this one has a specific drug that some trucks might carry, some they usually don't. Flumazenil. That's, look for that drug. That would be your drug of choice for benzodiazepine overdoses. So things like Benadryl. Next is going to be your beta adrenergic blockers. These patients are going to be low and slow. Think you're blocking beta receptors, right? So your breathing is going to be shallow. Your heart rate is going to be low and slow. Everything is going to be slowing down because these beta adrenergic receptors are being blocked. So this requires usually a full GI flush. And on the truck, we can give glucagon, specifically if they're experiencing hypoglycemia. But glucagon is our treatment for beta adrenergic blockers in the field to stabilize and transport these patients. Calcium channel blockers are going to be slow and acidic. So calcium channel blockers, calcium affects the intrinsic rate and force of contractions of the heart, right? So if you block the calcium channels, it's naturally going to slow down your heart rate. And acidic too, because right, you're producing too much acids through this, but your breathing is slower. Everything's slower, so you don't burn it off fast enough, so you're going to need to worry about your acidity. So for these patients, you want to monitor your ABCs like you would with every patient, and calcium, believe it or not. So our best treatment in the field for calcium channel blocker overdoses is to load it with more calcium. It's usually not the result, or usually not the solution, but with these drugs in particular, it is. So look for your calcium gluconate with these patients. Cardiac glycosides, kind of worded it funny here, but you're going to be complaining of stomach pain and they're going to be tired. This is going to be your digoxin overdoses mainly. So if we don't have digoxin on our trucks, or we don't have Digiban, which is the direct cure for digoxin. So if not that, then you would use atropine to treat any form of bradycardias while you transport and hopefully get them this Digiban. Next is cocaine. So cocaine, think they're going to be pissed and hurting. So cocaine's going to get these patients very excited. Their senses and everything's going to be all in overdrive, and it's going to hurt. So if these are another patients here where you can try charcoal, if they've already absorbed it, it's not going to be super helpful, but it's a start. And treat seizures with benzos. Now, salicylates, it's going to be ringing and warm. So a lot of salicylate patients complain about tinnitus. They complain about ringing in the ears. And they're going to be warm, possibly diaphoretic, right? So these patients in particular in the field will manage the ABCs here. These patients, if it's severe enough, will usually require dialysis to get the salicylates out of their blood. Now, SSRIs are QT and restless. So think of QT prolongation, and they're going to be nervous, right? They're going to be restless. It kind of looks like what you would expect with an MI with these patients as well. You manage them by treating your ABCs, and you can try charcoal. Now, ethylene, here's where we get into alcohol. Now, ethylene is going to be breathing fast and slurred. So they're going to be tachypnic, and their speech is going to be slurred. With these in particular, you can treat with thiamine to help relax everything, slow things down. And your PAMs, your diazepam, your lorazepam for anxiety. And methanol is going to be your drunk and blurred. So think of if you had one too few many drinks. You're you're drunk, your slurred speech, tachypnic, and your vision's going to be blurry. With these patients, we want to correct acidosis and treat and transport, monitor vitals, correct acidosis. Now, tricyclic antidepressants, they're going to be dry and they're going to be seeing things. So they're going to have those dry mucosal membranes, and they're usually going to be hallucinating. They'll be seeing things. Now, with this, once again, for a lot of these, monitor your ABCs. And with this, you can try sodium bicarb if you suspect acidosis, or you can breathe for them to treat acidosis as well. Carbon monoxide, and they just ain't breathing right. So these patients are going to look more red, kind of be flush, and you'll get your characteristic high O2 sats. With these patients, carbon monoxide, you don't want to be in there because your scene's not safe. Because, if they're being exposed to carbon monoxide, you are also being exposed to carbon monoxide if it's filling the room or something like that, right? So first thing you're gonna want to do is get them out of the scene. Get you and the patient out of there, right? Now, it's a little different if they were trying to attempt suicide by funneling their car fumes back into their vehicle. Either way, you don't want them around the carbon monoxide anymore. Get them out. Give them high flow O2, right? Because the thing is, you get these high O2 sats because your O2 saturation monitors can only check for the amount of bound hemoglobin. It doesn't care what is bound to it. And carbon monoxide is very keen to binding to the hemoglobin in blood and red blood cells. So you will get a falsely high reading. Get these patients on high flow O2, 15 liters per minute, if not higher. Now, organophosphates, it's going to be back to the cholinergic They're going to look very similar. They're going to be gross and they're going to be wet. And back to your sludgeum. They're very similar in presentations. Now, these you will want probably doxime. Butchered that, but anyway, this will be your direct treatment for this. Some trucks carry these, some don't. And finally, we have cyanide. I call these patients red devils because they have a characteristic cherry red appearance to them. Skin's gonna be very flush, sweaty, and for these we want a direct peritoneal shot of hydroxycobalamin or cyanokit. It's vitamin B12. So that is our direct cure for that. So anyway, I hope this helps a little bit. Anyone who ever watches this video in the future. Thank you.